So we're talking about mental health, and I just kind of want to jump right into this. As it relates to security professionals, what is the one thing that you think everyone needs to start doing in our industry?
Yeah, I think one thing that everybody would benefit from, regardless of what industry you're in, to be honest, would be building and maintaining resilience. And if you don't mind, just because sometimes we assume people know what we're talking about,
Mhm.
resilience is essentially, having that ability to adapt, you know, healthily, not just adapt, but adapt healthily when you're hit with stress, adversity, trauma. Just like life throws curveballs. And so it's that ability to bounce back, move forward, regardless of what might be happening on the sidelines.
Gotcha. I love the way how you frame that in this talk that you're giving coming up, resilience. Because sometimes with mental health, I think there's sometimes a bit of a connotation with it. But when you frame it with
Mm.
resilience, especially for our profession, the kind of the benefit of it is almost embedded in that keyword that you're using.
Yeah, and really not just me saying this and seeing it in my own practice, but also the research shows that it benefits both mental and physical health. And I think, that's just people are coming to understand more and more how those two are so intertwined, the mental physical health facet. So I'm sure we'll talk more about that over the next 20 to 30 minutes.
Exactly, exactly. Um, when you bring up these topics of talking about building resilience or mental health, what tend to be the common objections or reactions that you tend to get, or any of the sort of pushback that you might get?
Yeah,
Because I know that's pretty
I
common
think
in this industry.
I think that the natural pushback is um, depending on who you are, right? There are some people that still place a pretty huge stigma on the term mental health or therapist. Like I was just having a therapy session yesterday with a client, and he said when he told no, he's in his maybe 40, okay, and he told his father that he was going to start talking to me, and the guy's like, "Ooh," the father was like, "Oh, that's not good. They're going to mess with your head," and I was like, "What?" Right. So I think just the idea of mental health or therapy can still have a stigma, less so now than, say, 10 years ago, but we still have a lot of work to do to kind of quash stigma. And the other thing is, um, part of what you and I will talk about is when I talk about building and maintaining resilience, it has a lot to do with my absolute favorite theory in psychology called cognitive behavioral theory. And one of the reasons why I love it so much is because it works on the mindset, cognitive behavioral, meaning what we think, sparks emotions, affects how we behave, and thus how we live our life. And the reason why I love it so much is because we as humans have the ability to control our mindset. So that means that it's not going to be Mary Beth's magic wand that makes you better. You're going to have to do the work. And you realize some people are like, oh my God, I didn't realize that just shifting my mindset can do X, Y, and Z and A, B, and C. And other people are like, shit, you mean I got to do work? So it just those are some of the you have different people, and some people are totally willing to do the work, and some people just want me to do the work. So that's other than that, I don't see a lot of objections to people. Once they really understand all the benefits of resilience, it's hard to not want to work on it.